I'm Abdul Nasir Haji, an ENT clinician. I'm going to moderate today's session. There's one of our panelists who is currently trying to join. Yes, I can see he has joined, Dr. Ngugi. Very good. So I think we can continue. Allow me to say one word of prayer before I start. In the name of God, the most gracious, the most merciful, that's sufficient for us to begin the session. It's my pleasure inviting all of you to today's session. This session marks the continuation of our series on our ear and hearing care in commemorating World Hearing Day, which is globally held on 3rd March every year. Now this evening, this afternoon, we'll dive into demystifying hearing loss, which in the concept, most of the people have their own myths, misconceptions, attitudes, and cultural beliefs about this topic. And our panel of experts are ready to give us an in-depth entry into this topic. So allow me to introduce all of them. I think when I'm introducing, I don't know whether the host can give them to put on the cameras so we can see them. The first panelist, Isaac Wahome. He's a clinical audiologist. He's a consultant audiology and hearing care technology based at Kenyatta National Hospital. Our second speaker, Dr. Nicholas Ngugi, is an ENT head and neck surgeon with a specialization in head and neck. Ngugi, thank you. Say yeah, just say wave to the members. Isaac, you can also wave to the members. They can see you. They can put the name into your picture. Isaac Wahome is a clinical audiologist, a consultant audiology and hearing care technologist based at Kenyatta National Hospital. Dr. Nicholas Ngugi is an ENT surgeon with a fellowship in head and neck. He is currently based at Kenyatta National Hospital. Our third speaker will be Dr. Lillian Moko. She's an ENT surgeon, currently based at Kenyatta University Teaching and Referral Hospital. She has a lot of interest in otology, and I think she's going to be going for her fellowship anytime soon. Dr. Elian Yuko, she's also an ENT surgeon based at Kenyatta National Hospital. She also has a lot of interest in otology. So with that introduction, I think we can begin our session. On hearing loss.
Have we started? Okay.
Haji, I can't seem to hear much. The sound seems to have gone off.
At least for me, I can hear now.
I can hear you, Elaine, but I can't hear Haji.
We're demystifying hearing loss, and we would also, as we go along, we will be demystifying and giving some clear definitions and even debunking a few myths. So as we start, Dr. Moko can also, before we start with the question and answer session, Dr. Moko can also give us a preamble of this year's activities and what was the main thing and what has been done this year, because I know there was also an event at we had an event at KICC. Yes, Dr. Moko, you can continue.
So good afternoon, everyone. My name is Dr. Moko. I am an ENT surgeon based at Kenyatta University, Teaching Referral and Research Hospital. And this year we celebrated World Hearing Day. It is an annual event that is celebrated every 3rd of March. And this year's theme was demystifying the different societal misconceptions and changing the mindsets of people, basically on ear and hearing disease. And usually we don't only mark the day on 3rd of March, but that is when globally everybody marks the day. But then the whole month of March, and of course the whole year, should be a day that we take time to focus or to put some effort in our ear and hearing health. So this year we had several events. There were different screenings and sensitizations that happened in the different counties, mainly conducted by the ENT surgeons in those countries and the audiologists and the ENT clinicians. And for the Ministry of Health, the Ministry of Health conducted a workshop, a stakeholders workshop, where we had a meeting between members of the deaf community and members of the hearing community, with the aim of us changing the different misconceptions we have towards the people with hearing loss, and also having to hear what the people with hearing loss have to say and demystify it, with the aim of improving inclusivity of people with hearing disabilities. And it was a well-attended workshop. And now we are doing this webinar series. We did the same last year. And we're also hoping to give a teaching to demystify some of the concepts that we could be having that are not right, especially regarding ear disease and hearing loss. And thank you.
Thank you, Dr. Moko. I don't know if Isaac was back on the call. So I will allow the other panelists who we had on board also to introduce themselves. Dr. Ngugi, you can introduce yourselves one by one, and then we can start on our question and answer, on our discussion.
Good afternoon, everybody. My name is Dr. Ngugi. I am an ENT surgeon based in Kenyatta National Hospital, and also work as a head and neck surgeon. Thank you for joining us for this session for ear and hearing care. We've been trying to observe World Hearing Day with the aim of improving world ear and hearing care. So that has become our priority this year.
Thank you. Is Isaac back on the call? Okay. Okay. So Dr.
Can you hear me?
Yeah. Yes. Who is back? Isaac or Haji?
Haji, I'm here.
You're here. Welcome. So do you want to continue and take over?
No, continue the introduction, although I did earlier, but just continue with that part, then I can take over the other part.
Okay. So maybe there's something that I would prefer you had asked me to answer, but I'm preferring Dr. Moko, because she's in a new referral, teaching and referral hospital. She'd be best to tell us what are the types of hearing loss with the latest, what are the latest classifications that we are currently using, because this is also important for us to know, especially when we are classifying people as in disability, and the affirmative action that they should possibly get. Thank you.
Thank you, Dr. Yuko. I think I was hearing you were doing introductions. Ngogi did his introduction. Dr. Moko, did you introduce yourself? Or I missed that?
I did. Yes, I did.
Okay, thank you. Dr. Yuko? I didn't hear you
Yes.
introduce yourself.
Oh, true. I just started. My name is Elaine Yuko. I'm an ENT surgeon at Kenyatta National Hospital. I also am part of the otology clinic. Yeah, sorry to have not introduced myself. So I can now let my colleague give us our latest definitions.
Okay, thank you. Isaac, are you back? Isaac, back?
As we
I
seem to
believe
be having.
I believe Isaac is back. Isaac, can you hear us? We still can't. I don't think I can hear you.
I think we just proceed with the discussion part.
Okay. Perhaps Isaac can work on the audio. We can see you, but we cannot hear you. Haji, are you still there? Okay. So to talk about hearing loss, basically hearing loss is the loss of the ability to hear. And ability to hearing is basically one of our 5 common senses, meaning that hearing is a very important aspect of our life. The one thing is that most ear diseases and hearing loss usually is a silent, it is considered a silent disability. And this is because of the fact that most ear diseases or most hearing problems do not manifest themselves in a way that alarms people. You actually, by the time you get to have the signs and symptoms, you find yourself, it is already a bit too late. And at that point, you require a form of intervention. So it is a silent disability where it occurs slowly, progressively. It is very difficult to notice or to even pick someone. And the first, we were to look at the different definitions in terms of what hearing loss is, what is hard of hearing, and what is deafness. And in that sense, as hearing progressively declines as you develop this problem with hearing loss, you have presentation in various ways. So all of us are born with a baseline level of hearing, which if you have a congenital hearing loss, it will be at a baseline level, which is usually measured by audiologists. In terms of grading, we grade it according to the World Hearing Organization grading, though we have many other gradings, like we have many other gradings. But in the World Hearing Organization type of grading, we have mild hearing loss. That is when it is categorized in decibels. I will save you the details. I will talk about mild hearing loss. And then you can also have moderate, and then we can have moderate to severe hearing loss. And then you can get severe hearing loss, and finally profound. Profound hearing loss is when you can totally not perceive sound at all. And this is the level which we call deafness. And in between, when you can hear some sounds and probably not be able to appreciate very well, that is between moderate to moderately severe and severe hearing loss. Those are mainly the people who we say have hard of hearing, where they have a difficulty perceiving proper sounds or sounds properly. And then you have the mild form of hearing loss, which is a different category, which is most of the time asymptomatic. So that is basically to define hearing loss and to talk about the different types available. Again, you can look at hearing loss in the form of reversible or irreversible hearing loss. As we all know, the ear is an end organ. And so when you have damage to the ear, just like when you have damage to the kidneys, it is very, very difficult to repair as it is with all the other end organs in the body. So any issues that affect the external ear or the middle ear are the ones which we usually commonly term as reversible causes of hearing loss, where the inner ear, which is the main organ of hearing, is spared, and this can be sorted, or they can be reversed by various medical or surgical interventions. Then we have the other component, which is the irreversible or the permanent hearing loss, which is usually the most common type of hearing loss that happens when you have damage either to the cochlea, that is the inner ear organ of hearing, or to any connection between the inner ear and the brain. And this one usually gives you a permanent or a sensorineural type of hearing loss. So back to Dr. Yuko.
I think I didn't want to usurp Haji. Haji, you want to take over moderation? Okay. Then in that case, Wahome, are you audible now? Okay, Wahome is not audible. Dr. Ngugi, thank you very much for now telling us what causes these different types of hearing losses. We hear there are some that are called conductive, some are caused issues with nerves. So maybe Dr. Ngugi can give us the details of this.
Thank you, Elaine. So I'm sure most of you might have heard maybe your clinician talk about conductive hearing loss, sensorineural hearing loss, or mixed hearing loss. These are just clinically just to say what's happening with either the organ itself of hearing, or what we call the cochlea, that's having an issue, or it is the nerve that leads out of the ear that's having an issue with the hearing. So any damage to any of these areas will give us something called sensorineural hearing loss. Now, conductive loss means that it's just basically we are not able to transmit the sound appropriately to the organ of hearing. So either you have a lot of wax in your ear, you have an ear infection that has a lot of fluid in your eardrum is perforated for one reason or another. This would give you what we call a conductive, because now we are not able to transmit the sound the way it's supposed to go through the ear, into the eardrum, into the small bones of the ear, and then into our organ of hearing, which is the cochlea that is within the ear. Now, you can have a mixed picture where both there is inability to transmit the sound as well as inability to perceive the sound that is being brought in, and gives you some that that mixed hearing loss. Now, the most common causes of hearing loss in our setup tend to be issues related to either either being born with issues that have had, you're not able to transmit the sound properly. Other things come into play, such as viral infections, meningitis, can give you those kind of early stages of hearing loss. Later on, as we mature or as we grow older, the process of aging sometimes lends to some difficulties in perceiving of that sound, or even having this accumulated hearing loss due to a lot of damage, either due to loud noises, due to either the places we work, or our general home environment, or sometimes even our recreational activities. All these sometimes culminate later on in life and tend towards not able to perceive sound as well as we were able to before, or your ear is not able to conduct your sound as good as well as it was, because now either your eardrum is getting very thick, the skin around the ear is getting also floppy, the bones around the ear, the little bones in the ear are not able to move appropriately as well. In terms of, as Dr. Moko had said, reversible or irreversible stages of hearing loss, those usually are usually determined by what has caused the hearing loss. Most sensory neural hearing loss most times tends to be irreversible, or even if it is reversed, will not revert back to its near normal, back to the normal state. Some conductive hearing losses can be amended, because it literally means that if there's something preventing your sound from reaching the organ of hearing, for example, if you have excessive wax in your ear, that can usually be remedied. If you have a perforated eardrum that's lending you to have some conductive loss, that can be remedied to a degree. If it's something that the bones are not able to move effectively, there is a way to go around this, but it might not be a foolproof, or might not give you back near normal hearing, but it is amendable. Thank you, Aline.
I don't know if Wahome is able to answer, to speak. Are you audible now, Wahome?
I don't know whether I'm audible now. Can you hear me?
Yes, we can hear you. Thank you very much for being audible as you introduce
Can you also hear me?
Yes, we can now hear you, Hajan. We'll allow you to take over. So, Wahome, as you introduce yourself, now that everybody knows you're called Wahome, can you hear me? Maybe you can tell us about how do we know that we have hearing loss? How do we get to know that we have hearing loss, or someone around us? And how do we prevent hearing loss? And also, what can make me suspect that somebody, or an adult or a child, has hearing loss? Thank you.
Yeah, thank you very much, Elaine. I think this year we're trying to demystify hearing loss in many aspects, because this is a common problem that we get to face every other time, either your loved ones or a friend or a colleague who has a hearing loss. And most of the time it has been something that people have been hiding. You realize that there are people who have hearing loss, they can't hear, they can't answer properly, and they are not, they don't want to come out as people who have a hearing problem. And this is a very good forum that we're trying to demystify hearing loss. So there are so many ways that you can detect that you have a hearing loss. As an individual, number one, when you're having conversational trouble, you can't be able to hear people clearly. And the commonest place where you cannot be able to hear clearly is usually in a noisy environment, or where more than one person is talking and you're having difficulty to follow a conversation. Definitely there is something wrong with your hearing. And of course, for the people who are around you, they might tend to repeat a word or a sentence when they're talking to you, or a command. They might notice that either you're using too much volume, or you have increased your volume when you're listening to a television, or your ringing tone, or even when you're talking with your phone, they can be able to follow up a conversation on the other end when the volume is too high. So these are, especially in adult, are things that you can be able to pick up for somebody who has a hearing loss. For children, number one, depending on the age, most children that we have seen, they present in clinics with delayed speech. Because remember, the hearing and the brain development and speech development is like a sponge that absorbs sound and then sort of replicates it back. So children will always present with delayed speech, depending on the age. But if they are grown up enough, you'll notice that they might actually start saying that they can't be able to hear well, either from both sides or one ear, depending on the age. So most of the time, you'll start seeing some changes in their behaviors. Some of them will be a little bit hyperactive. Some of them will have some different mannerism, like anger and so on. Those kind of features that will start presenting some of these children. Number one, so we are saying that hearing loss can come at any age, and it will present differently depending on the age. From the small children, that is from 5 years and below, that might present with absolute no speech, or difficult in articulation, or even words that they're speaking, there are some missing words, or difficulty pronouncing certain vowels and articulation. Some of them, the teachers might notice, and they might actually complain back to their parents that their children are not able to follow some instruction. So it is varied depending on the age and depending again on the level of hearing loss. Thank you, Dr. Yuko.
Thank you, Isaac. You've been very comprehensive. Haji, do you want to take over back?
Let me try and see. I think I am back. I've used my own internet now. Earlier, I was using the facilities connectivity. So you can hear me now?
Yes, we can.
Thank you. Thank you. And sorry for the interruptions. Sometimes technology can hold you hostage. Thank you, Dr. Yuko, for holding on my behalf. Let's continue. I don't know where you had reached, but then I just want to take you back briefly. Isaac, there are many words that are usually used when we are talking about hearing loss. Other people will use hearing loss, others will talk of hard of hearing, others will talk of deafness. Maybe briefly, I'm sure time may not be on our side. What are those three words mean?
Yeah, so the three words, they are totally different. And I think the most important thing to understand is that the grading of hearing loss. And we grade hearing loss, number one, after you have been done a hearing test by an audiologist who is going to say you have what type of level of hearing. And an audiogram is one very important tool that, especially for people who are above 5 years, that we use so that we can grade. And we grade into 5 levels. Number one, people who have normal hearing, the normal range is between -20 to around 20. And then from that, we start now grading hearing losses from mild hearing loss, moderate hearing loss, moderately severe, severe, and profound hearing loss. In the society, most of the time when we say and we hear this word and we are trying to demystify that and stigmatize, the stigma is that people who have the very low sort of hearing, what we call profound hearing loss, some, especially if you get a hearing loss early from childhood and speech has not developed, these people from the society, we will hear words such that like deaf and dumb. Really, they are not dumb. It's that they are not able to pronounce any word. And these are individuals who are able to perceive very loud sounds. And we are talking about 100 decibels and above, or 90 decibels and above. And 90 decibels, it is equivalent to, sound of a siren, an ambulance siren at an arm's length. So this is very, very loud. So these are most people that we refer them as deaf. That is 90 and above. And then we have another category, hard of hearing. Hard of hearing is individuals who are between 70 to around 90. Those are hard of hearing. And then these other ones, we say that they have hearing loss. So remember, when again we categorize in terms of degree, we say that if you have mild hearing loss in a classroom setup, you cannot be able to hear 25% of a conversation. For moderate, you can't be able to hear 50% of a conversation. For severe, you cannot be able to perceive and understand 75% of a conversation in a classroom setting. For people who have 90, you actually cannot be able to hear anything. The only thing that they use is alternative communication skills that include lip reading, argumentative listening, by following cues, and facial expression and body expression and so on. So these are really people who we say they are, they're deaf, but if they have again a challenge in terms of speech, they might not be able to pronounce any words, but they can be able to actually lip read and follow visual cues. Thank you very much, Abdi Nasir Haji.
Thank you, Isaac. Dr. Yuko, I'm sorry, you moderated for me, so I won't spare you still. I'm sure I was hearing Dr. Moko trying to describe types of hearing loss. But then, what do you think? What could be the signs and symptoms? Patients complain of different kinds of signs and symptoms for patients with hearing loss. What will you say about signs and symptoms of hearing loss, Dr. Yuko?
I think one of the first signs and symptoms is maybe we might check like, I know if you find people are always asking, can you hear me? So even us among us here, we could have had some hearing loss because if you're always having to repeat, if you're always asking people to repeat, if you lean in, many times when you talk to people with hearing loss, adults, they lean in and they give you their good ear. That can also give you, that's another one of the other signs. When parents tell you that this child is in kichwa ngumu, that they don't listen to them, or that sometimes the child ignores them. And especially when parents tell you this, you have to ask them the setting, because there are some sorry, was I muted?
No, you can hear you. Continue.
Hello, Haji.
We can hear
We can hear you. Continue.
Okay, so there are children who have fluctuating types of hearing losses because of conditions like otitis media with effusion, and the children will have issues like with adenoids and tonsils. So those type of children, the parents sometimes will say that this child sometimes ignores me, and sometimes they respond to me. So maybe the basic ones I can say are like those ones are where you notice that somebody, an adult or a child is not responding. When they lean in, when they use very high volume, as Wahome said. One of the other signs that you notice is in school, when you're told that the child is not performing well. So many times before we just go and say that the child is maybe having maybe some intellectual issue. Sometimes it's good to check the hearing also, because especially with after COVID, when people started wearing masks, there are many deaf people or people who had hearing issues who used to rely on lip reading. But now that with the masks, that became a problem. In school, sometimes teachers talk when they are in the board, so you also ask about school. The other thing is when you notice a child who becomes withdrawn, and sometimes they are withdrawn, they don't socialize much, or they can become very aggressive. And there are many times we've had children who have been classified as being in the autism spectrum. And that is why before, the pediatricians will always refer them for a hearing test first to make sure they can hear before we say that, because sometimes it is the psychological effects of being hard of hearing that causes that is making the person or the child react like that. Because adults will become more withdrawn, will think they're depressed, but they're having difficulty following conversations. Children will feel isolated, so they will act out. They might throw tantrums, or they might become very quiet. They might become very antisocial. So off the top of my head, those are the common ones that I can remember. Did you ask another question at the end of it?
No, thank you. That's okay. Dr. Ngugi, there are many causes of hearing loss and deafness, and outside there, the myths and misconceptions and attitudes of cause of hearing loss might be too many. But what are the real causes? What are the real causes of hearing loss?
Thank you, Haji. So there are a lot of misconceptions that are there about hearing loss. Some are related to cultural beliefs, such as being bewitched, or you ate certain foods that will give you hearing loss. So those are usually the common misconceptions we find about hearing loss. Now, the most common causes of hearing loss for us tend to be either you were born with, for the younger ones, you were born having some element of hearing loss and it was not picked up in good time. For the younger adults, older children, we tend to find infections tend to give us this. And one of the biggest causes of this is usually meningitis, or after you get meningitis. Another cause of hearing loss that also happens is what we call noise-induced hearing loss, which tend to get a lot of later on in life, especially tend to be men who are around 40s to 50s, who ended up working in factories, working in any element of manufacturing, or you actually find guys who actually stay in very loud environments such as, matatu terminuses, markets, and are in places that have high noise volume or require them to be exposed to that high noise volume. Now, there are causes that we say like things can cause you to have hearing loss, but not all of these things are true. Not all discharge from the ear will give you hearing loss. Wax is one of the things that will give a lot of people some element of hearing loss, which is quite reversible. And the biggest reason why people tend to get a lot of excessive wax in the ears, literally because of cotton buds. And cotton buds are not designed for your ears. They're technically initially designed for your nose, and are designed for children's noses to allow mothers to be able to clean out children's noses. But you can find nowadays they've even gone away from saying, they even write in the packaging, do not put this in your ear. A lot of things also that are thought to cause hearing loss are things like swimming. Now, we've had some people come up to us and say they don't swim or they don't engage in certain water activities because they said, somebody went in the water and they got deaf. But most times this is not usually true. Swimming can give you sometimes can increase risk depending on whether the water is clean or dirty, can give you risk of getting an ear infection, but not necessarily cause you to be deaf. Other than that, most of the things that we find that cause hearing loss are things that happen over a period of time and sometimes are not easy to pinpoint. One of the things, like we were saying, was the hearing loss that happens to the younger children who were born with an element of hearing loss, didn't get augmented, so they didn't develop language properly. So now you find that the child is manifesting at 4 or 5 years when you thought the child could hear, but maybe was hearing because either they were lip reading, like Dr. Yuko said, or just taking social cues on what's happening. But now when they get into a new environment like school, they tend to kind of be picked out that there's something that's not quite right with these children. Same thing happens to our older population. People who are used to hearing slowly within a course of years have been losing their hearing. Maybe you start losing your hearing from the age of 60 and you're 80 and people are wondering what's happening to you. You're not as lively as you used to be. But because over time you've lost hearing, you've had trying to compensate either by lip reading, having people talk to you in a louder voice, but the hearing still continues to deteriorate and you would start to withdraw from social activities, and people think that maybe either you're depressed or somebody has put an evil eye on you. But in essence, it is because literally you are able to cope and you're trying to find you have social embarrassment and you don't want to engage in that sort of scenario. Thanks, Haji.
Thank you, Dr. Ngugi, for that in-depth discussion. Dr. Moko, Lilian Moko, outside the conventional diagnosis and identification of hearing loss, when you go back to the community levels, how can we identify and diagnose hearing loss from the community level?
Okay. Thank you so much, Haji. So when you talk about identifying hearing loss in the community level, the household is a basic unit in the community. And so we want to look at the people in the household. First, at any given time, anybody is at risk of developing a hearing loss, be it the children in that household or in that community, the middle-aged adults, the old adults, all of them are at risk of hearing loss. And so when we talk about identification, we want to identify them early, and you want to look at their behavioral or their behaviors, especially towards how they perceive sounds and how they communicate or try to speak. And so as all the other colleagues have talked about, most of the time when you talk about behavioral, you're looking for some of those things such as children who have speech delay, children who also might develop some speech, and at some point the speech comes down or it becomes poorer. They're not able to articulate their words clearly. That could be an indication. Sometimes if you have children who are hyperactive and not following instructions, before you label them, one of the commonest misconceptions we find with children who have a hearing loss is that they're labeled as naughty children or delinquents. So these children are children who probably are not able to hear as you communicate the instructions, or even as you teach them about the common basics of day-to-day living. And so these are children who will not adapt. So most of these children also are children who have a hearing loss. And so if you identify them, then you know that this is probably a problem with hearing. For us who have gadgets in the houses, we have use of gadgets at a disturbingly loud level. But you find that at a normal volume, everybody is able to hear well. But then you have one particular individual who tends to always want to pick up the volume, or sometimes tends to turn their better ear towards the device that is giving sound, or towards the person who is talking to them. That's an example of how you can identify somebody with a hearing problem in the community. There's also people who tend to confuse the language, or rather they confuse the words. For example, if you have, and this is very common in the elderly, if you're asking them for shoes, they hand you a shirt. Or if you're asking them for, so you find that most of these people who confuse the words, who have a problem with communication, you're telling them one thing, but then they respond using a totally different thing. That could be an indication that this person has a hearing loss. We also have people who have isolation, or people who speak in extremely low volumes. You have to hear yourself so that you can know whether you're speaking loudly, whether you need to lower your voice or you need to raise your voice. But if you have people in the community who have a constant monotone that is most of the times very low, and for people who, there are others who also have a constant monotone that is very loud, that is an indication that that person has a hearing loss. The one who speaks very loudly is somebody who has to speak too loud in order for them to perceive their own voice. And the other people who speak slowly are people who have mainly inner ear issues, and you find that they're not able to perceive. So those are some of the common things that we use. But of course, now with technology, we have different screening applications on our devices. You can download. WHO has a clinically validated application where everybody can download and use on their smartphone at the comfort of your own home with your own earphones, and you can do a simple hearing test. Also on Google and on iOS, we have different hearing screening tests. And if you use that, you can use it to screen yourself, meaning you can use it to basically test whether you have normal hearing, and it can point out to you, and this would prompt you to go to the nearest ear and hearing care provider for you to have a diagnostic test done on them. Thank you.
Thank you, Dr. Lillian. Isaac, many times I can even see from the chat, people are asking where can they get these services. So how do you manage hearing disabilities? At what level will you recommend to be managed, and different levels of care?
Thank you very much, Haji. Again, hearing loss is very common, and it is very easy to, number one, diagnose. And diagnosis, the way we do it for children is a bit different from adults. And we start diagnosing from day zero, from the time a child is born. You are able to do what we call screening hearing assessments with some very nice, non-invasive, quick test of the ears. And we are able to tell whether a child is able to hear or not. So the first thing is mothers who have delivered should be able to at least take their children for a hearing assessment. And then we have this other category from that time where from now the older children who we are able to do other diagnostic tests that include, brainstem testing, a little bit specialized. And then we have other tests that includes audiometry testing. And all these tests are done by an audiologist in a center like in Kenyatta National Hospital. If you come to clinic number 34, you can just come in and you're tested for your hearing. We always encourage you to pass through your ENT or your general physician just to sort of to eliminate or remove common causes of hearing loss like wax impaction. So they can quickly, with an otoscope, just quickly check inside your ear. And if there's anything that is blocking transmission of sound, what we refer as conductive hearing loss, that is something that can be managed at the primary level. And then for people who have now other types of hearing loss, like sensorineural type of hearing loss, then they are referred back to us and we are able to do more comprehensive hearing assessment. Yes, for sure, there will be intervention for hearing, and I will encourage people to join in to tomorrow's discussion where another panel of highly specialized people will be talking about the interventions, either with a hearing aid or a cochlear implant or surgical intervention or ear syringing. The different interventions will be mentioned probably tomorrow. So today we're talking about hearing loss, and I think it is very important for you to visit your physician or your doctor close by if you suspect hearing loss. They will always, or you can visit directly the audiology clinic where they will be able to do some measurements to determine your level of hearing.
Thank you, Isaac, for that. Dr. Ngugi, according to most of researches and data, hearing loss is preventable up to 60%. So what will you advise? What could be the prevention measures that people should do before they get hearing loss?
Thank you, Haji. I'd like to say hearing loss is one of those disabilities that have life-changing, life-altering situations, but can be reverted back, and patients can actually get back their hearing in one form or the other. Now, as always, prevention is better than cure. So one, keeping ears clean, keeping them healthy, not putting anything that you don't need to put in your ears. If you suspect any problems with your ears, go and see an ENT clinician to sort you out. Early diagnosis of children with hearing problems, early diagnosis of adults and elderly patients with hearing problems. These are the key things that actually allow hearing either to be kept safe, to be maintained as is, or to be improved. Now, God forbid that you should end up having some element of hearing loss. Now, depending on what exactly it is, if it is a conductive loss, some surgeries are available for correcting these situations. If it is something that is sensorineural, either we can choose to augment the hearing either through different types of hearing aids, as well as behavior modification or lifestyle modifications, such as talking to people in well-lit rooms, talking to people in their face-to-face, letting people know that you actually have a problem with hearing so that they don't shout at you, they're not screaming in your good ear and messing up, causing problems with the good ear, and when you already have a problem with one ear. In other circumstances, we have cochlear implantation, which is taking off pretty well here in the country. And also other very advanced things such as brainstem stimulation, which we don't have quite at the moment in the country, but it's available for patients who have something hearing loss that is beyond the ear, that is occurring due to either some malformation within the brain. But as I said, Haji, the first things first, keep your ears clean, keep your ears healthy, don't put anything in your ear. And if you have a problem with your ear, see somebody who deals with ears and ENT.
Thank you, Dr. Nicholas Ngugi, for that. Dr. Moko, hearing loss has its impacts, has its own aftermath, results, its own complications, its own effects. Now, what do you think are the impacts of hearing loss, Dr. Moko?
So hearing loss, mainly hearing is important for us to have communication and day-to-day interactions with both our environments and the people that are around us. So when we look at the impact of hearing loss, the impact of hearing loss is quite multifactorial, but you can mainly narrow it down to the social impacts. And most of the social impact come in delayed development of speech and language, or a problem with communication for the people who already have developed speech and language. And so this leads to social isolation, loneliness, frustration, and as Dr. Ngugi said, sometimes even these patients present with issues such as depression, psychological issues, and the recently discovered one dementia. The Lancet Commission on Dementia Prevention and Intervention, CARE, identifies hearing loss as the most important and modifiable risk factor for the development of dementia. And it works both ways. Old people who have hearing loss sometimes are misdiagnosed as to be having dementia, just that they have a problem with their communication. And then the social isolation and the loneliness, again, has been noted to be a great contributing factor in the progression and deterioration of dementia. Hence the importance of early identification and rehabilitation. When you look at it in terms of educational and learning, the impact is mainly great in children. And again, emphasis on the importance of early detection and intervention, because if children are not able to hear at a young age, they're not able to learn. They also have problems in education and in learning how to adapt on day-to-day life activities. So they grow up with a disability, which is a disability that can be adequately rehabilitated, and the children can be mainstreamed to normal school. And with this educational impact, you find that most of them who have issues, they do not develop or they do not reach their maximum capacity or potential in terms of both educational-wise, both career-wise, and even in employment. Young people who develop hearing loss have a problem in maintaining their jobs because they're not able to communicate effectively with their workers. And so, again, they find themselves going home early retirement, especially for the young ones in Jua Kali, and other informal industries. And this now overall leads to the economic impact. And the economic impact is felt both from all the way from the family level, community level, as a country level, and also globally. So you find that these people who end up becoming dependent, yet they are physically and mentally able, are not able to achieve the economic ability. And so we undergo great economic costs taking care of them. And the World Health Organization globally has estimated that hearing loss costs the whole globe an average of $980 billion every year. And this is in terms of the health implications of the health sector, mainly the losses that are incurred in the educational support and loss of productivity of these individuals in society. So in overall, prevention, early detection, and the intervention is the best way to overcome these impacts. And you can see that the impact of hearing loss is quite great and quite preventable or avoidable. Thank you.
Thank you so much, Dr. Lilian. Thank you so much. Dr. Yuko, some of these myths and concerns have already been mentioned by Dr. Ngugi, but there are many things surrounding community levels, individuals, cultures, and many other beliefs. And there are many misconceptions surrounding hearing loss and related diseases. So
What do you think are the major myths and misconceptions, and what will you say about it?
Thank you, Haji. Okay, I think one of the first ones is that I've seen a question in the chat asking, is hearing a disability? Hearing loss, is it a disability? So that's the first one. That is, you know, there's a misconception where people, as it's been mentioned before today, that hearing loss is a silent disability. So this is the first one where we need to debunk this, and also we need to assist the people who have any hearing disability, from mild all the way to the very severe. And this is important also, especially in schools, where if you have, like, usually when we have children with hearing loss, and it's not to the, there are some that are that we could treat surgically, or there are other times where they are more transient and we put you on medication, but we usually tell the parent to also go and talk to the teachers in school, so that the teachers know, and there's they can understand the child and give in the appropriate manner. So that's actually the first one, that the question that people usually ask, that is hearing really a disability? And many times, even if you don't see the hearing aid over the patient's ear, then over somebody's ear, usually then you don't tend to give them the special treatment that you do give all the other disabilities that we see. When you see someone who's not able, who's on a wheelchair, there's a special treatment that you give them. When you see people who have the cane for the visual disabilities, we assist them very easily, but the hearing impaired tend to be sidelined. So that's the first one, that is a misconception that we need to correct in several places. And even among us here, we should have had a caption, so that the people who have hearing disability could follow us. And in every social event, we should usually try and have somebody to assist the deaf, and just asking if there's somebody who has hearing disability within us. The other misconception people have is that on your phones and on all your devices, there's a level that is considered when you put those things on your head. There are all types nowadays. So that there's that red mark that you're told that this is the high level, that beyond here now you can get hearing loss. And usually it can happen very fast, even within just 3 minutes, you could give yourself hearing loss. But the myth is, the misconception is that if I just stay just below the red mark, then I'm okay. But by the time you're getting to that red mark, you already have quite a high volume. So you should try to be at a comfortable level that is significantly below that red mark. Because if I tell you that you can get you can damage your hearing from decibels of, let's say, 80 and above, or even 100, then I shouldn't just be playing at 99 or 79 there. So that's another thing that that we should try and correct people on, because it's a common thing that people are doing, especially now that meetings and several things, and even there was a time school was online, and it was mostly inside our ears. Dr. Ngugi has talked about wax, and even with the cotton buds, they are written, do not insert into both ear and nose. So they were meant to clean people on the outside, but generally shouldn't. We are told that the smallest thing that should be able to enter your ear is your elbow. So if your elbow can enter your ear, that's okay to clean it. But our ears clean themselves. They are self-cleaning, and if you constantly put things inside the ear, then you destroy the ear's self-cleaning mechanism, and you predispose yourself to infections, even things like boils, because you can get ingrown hairs within the ear. You can damage your eardrums. So many times you find there are people who have itchy ears, and they think it's because their skin, they have a lot of wax, or there's something wrong with their skin. But you could find that many times what they have is actually nasal and throat allergies. Because when you have, if your eustachian tube, which is behind your nose, as the people who are listening in on this call could try, you could pinch your nose and swallow, or pinch your nose and blow out your cheeks, and you'll feel your eustachian tube block, or even the movement of your eardrum. So if you're having irritation because of allergic rhinitis, allergic pharyngitis, you will get ear itch. And that type of ear itch, sometimes you'll find if you take something warm, hot, it tends to resolve, or even use the nasal sprays. So that's another thing that, like when a patient comes to me and they say they have, they want to use the cotton buds because their ears are dirty, and I put them on a nasal spray and they do not understand why they are left with a nasal spray and their issue was the ear. So issues around allergies around the upper aerodigestive tract are usually very important to understand, and we should not be cleaning inside our ears. I have just two more. There's all sorts of oils that people use because ear infections sometimes tend to be common in children because their eustachian tube, the one that maintains the pressure within our head and our middle ear area, is more, it is flat it's more horizontal in children, and so they tend to infectious agents can easily enter. When you have reflux of milk and food, it can easily enter into the middle ear and cause the infections. They also tend to get flus. A lot. So sometimes they do get the infections, and the eardrum will actually, use the colloquial term, burst, and there will be a discharge that comes out. And many times when people see the discharge, instead of taking the child to hospital, what they do is that they put oils, different oils. So the common ones you hear is like mafuta ya kuku, so chicken oil. When you melt the fat when you're cooking chicken, there are people who put that oil. People put brake fluid. People put gun. I don't know where they get it. The one for cleaning guns and all sorts of other crazy things that people put inside their ear to treat. Even in this day and age of 2024, I've seen people in town who have had, even there are people who have had a perforation because of trauma. Maybe they were slapped or something. Then they tell you. So usually those heal on their own, but these ones tend to stay because the patient tells you, I put the chicken oil inside the ear. So that's another thing that we need to, those are the type of myths we need to debunk. And the final one is, as we mentioned, that people with hearing loss, as we have said, they are not, many times are not, they don't have an associated mental issue, especially children, where we tend to grade them as having intellectual disabilities. So I think that's something that's actually a myth that we need to debunk, that people who are deaf are, the word that used to be used was retarded, which we should avoid using, and that also that deaf people they have limitations in what they can do. So the minor truth is that yes, if you have a disability, there are things that you might need to overcome, but with the different care, whether it is a treatable one, so if it is a surgical thing or medical, or if you require hearing aids, or even if you require for people to use speech and to use sign language to talk to you, but the people with hearing impairment are able to do to be completely productive in the society, and they're able to do several of the different jobs. There are a few that they might have a limitation, but there's a lot that the people with hearing impairment are able to do and be very productive in society. I think those are all for now.
Thank you, Dr. Eileen Yuko. I think time is not on our side. Maybe one simple I want to give to Dr. Moko, just 1 or 2 minutes. Dr. Moko, what is the relation? What is the link between hearing loss and speech? Just for 1 or 2 minutes. Dr. Lillian, can you hear me? Okay, Dr. Ngugi, can you hear me?
Yes, Ajay, I can hear you.
I can see Lillian may not be hearing well. So what I was asking is, what is the relation between speech and hearing loss? Just for 1 or 2 minutes.
So speech and hearing loss. So speech, think of speech as the engine of your car, and hearing loss is petrol. If you don't have petrol, your engine might not run, but the degree at which as your petrol diminishes, the function of the engine also comes down, but they might not necessarily be on the same level, if you know what I mean. So you might have more petrol, but they can't, you have a big, V8 that needs a lot of petrol to run it, meaning that you look like you have mild hearing loss, but you're not able to be able to engage in conversations with people because you're not able to perceive your level of speech perception is way lower than it's supposed to be. Whereas for some people, and you'll notice this a lot more for, like we notice this for our older generation, they can have very either most times just by either lip reading or even just by being able to perceive certain things or being able to I know a sentence is being okay. What is it that we don't have in cues? And some people might see this as something that's a bit different. So hearing loss is the absolute level of which you can perceive any sound. But speech loss or speech threshold loss is whereby you can perceive tangible words or you can perceive what people are actually saying in a conversation. So there are some conditions that render some people with very severe disability to sound, but their terms of their speech is a bit better because of what they can make out of socially. And then there's some who have very mild loss in terms of sound, but speech comes very low because they're not able to put two and two together. The reason why sometimes
we have a sort of time.
Okay, let me just finish up. The reason why sometimes we use speech is because speech should tell us whether
Dr. Ngugi, you're not audible.
Yeah,
Oh, you can't hear me?
Yes, we can't hear you.
Oh, okay. I was saying that speech is what we use in a day-to-day communication. And if you have low speech or we have severe speech loss or speech threshold loss, means that even if we give you a hearing aid, you will not be able to benefit from hearing aid, which technically tends to just augment the volume or augment the sound that is coming into your ear. Whereas if you are able to perceive speech, but your hearing is also low, but then you would be a good candidate maybe then for a hearing aid. Is that better?
Thank you, Dr. Ngugi. That's okay. Thank you so much. Now to conclude this, I think we have quite a number of participants, listeners in the call, and I would like each one of you to give 1 minute of your take-home message to the participants. Let me start with Isaac. Isaac.
Yes, Haji.
Your take-home message to your participants or listeners?
The take-home message is that we are trying to say that let's take care of our ears. If you have somebody who has a hearing problem, or if you are suffering from a hearing problem, don't stay with it at home. Visit your nearest ENT clinic, and then they can be able to do something. The other thing is that there are things that we are saying that we should try and avoid. Some of them is things like cotton buds. We should be, if we have to go to concerts or places where it's loud with the matatu and so on, we should try to protect our ears with protective mechanisms like putting earbuds or earplugs in such places that are noisy. If you're working in an industrial area that is really noisy with the machinery, it is important for you to have earplugs or earmuffs so that you can protect your ears. Again, 60% of hearing is preventable.
Isaac, thank you. Isaac,
yes, thank you.
Thank you. I wanted only one sentence, please, because of time. Dr. Moko, your take-home message?
So my take-home message is based on this slide that is there. We need to all be mindful and to be
considerate and inclusive of other people in society who could be deaf or who could be having a problem with hearing. So we need to take a moment and not just dismiss people who are not responding to us as people who are ignoring us. We also need to acknowledge that the fact that deaf people cannot hear, it does not mean that they are not able. So they are able. We have deaf advocates, we have deaf teachers, all sorts of professionals. So we should learn to be inclusive and try our best to learn sign language. There are classes available on Facebook, on TikTok, on YouTube, and even in various institutions that are now offering sign language classes so that we can be more inclusive to people who are having hearing loss and hearing disabilities. Thank you.
Thank you so much, Dr. Lilian. Dr. Ngugi. Take home message.
Message is don't put anything in your ear. That's it.
Thank you. Thank you so much, Dr. Yuko.
My take-home message is to parents and anybody who is in a guardian capacity or overseeing or even as a teacher. Trust your instincts. Trust your instincts. If you have a feeling that the person under you, the child or an adult, or trust your instinct. If you feel somebody has hearing loss, address it at the first time that you felt the instinct. Do not be discouraged by medical professions or even people in your family. If you're given treatment options, please take them because we're in 2024 and we are debunking many myths. Thank you.
Thank you, Dr. Yuko. I can see Dr. Lilian and Wahome have engaged our listeners and participants in the question and answer chat box, and they have responded to most of the questions. Thank you so much. Allow me also to thank the panelists, Dr. Ngugi, Dr. Moko, Dr. Yuko, Isaac, Wahome, for making this event very successful. And let me also appreciate the efforts and the hosting by KNH team, the research team, Nelson and his team, for giving us this time and opportunity to host this activity. And tomorrow we have another session of myths, facts, interventions in ear and hearing care. Kindly don't miss. Others, thank you so much. And thank you for listening and engaging with us in this group. And with that, I think I can call it a day because we are 1 minute shy of our time. Thank you so much. Thank you, guys. I'll see you.
Thank you. See you.
Goodbye. Thank you.
Thank you too. Thank you all.
Thank you.
Thank you to the
Good
panelists.
afternoon.
Thank you, everyone. Good afternoon.
Good afternoon.